Hey, welcome back. We're going to talk about cancer and family medical history and a little bit of homework today. So, nutrition-related illnesses. Unhealthy eating and inactivity contribute to 310,000 to 580,000 deaths each year, according to the U.S. Department of Health and Human Services. That's 13 times more that are killed by gun or 13 times more than are killed by guns and 20 times more than by drugs. So that's a huge number. The typical American diet, which we've learned a lot about over the last several weeks, is too high in saturated fat, which we learned is terrible for you, sodium, which we know is salt, and sugar, and too low in fruits, vegetables, whole grains, calcium for those bones, and fiber. Such a diet contributes to four of the six leading causes of death and increases the risk of numerous diseases, including these listed here: heart disease, diabetes, obesity, we've talked a lot about, hypertension, stroke, osteoporosis from that lack of calcium, and many cancers, including colon, prostate, mouth, throat, esophagus, lung, and stomach. So let's talk about the diseases caused by obesity. You can see here you have a normal heart on the, we're talking about the right top pictures here. You have a normal heart and you have congestive heart. The congestive heart, you can see, does not have the capacity to move as much blood or pump as much blood throughout the body. Okay. In the bottom here, you have the area of the brain deprived of blood because you have this clot that is stuck in the blood vessel that's going to the brain, which could cause a stroke. So obesity health risks. You can see around the obesity health risk circle here, you have cancer, you have gallbladder disease, you have renal failure, which would be your kidneys, you have stroke, heart failure, arteriosclerosis, you have type 2 diabetes, and you have hypertension. So a lot of different things are the result of obesity. We know good nutrition prevents heart disease, so how about cancer? Scientists say they really do not know whether dietary changes will make a difference in preventing cancer. And there lies a quandary for today's medicine. It is turning out to be much more difficult than anyone expected to discover if diet affects cancer risk. Therefore, knowing the warning signs is really extremely vital. So let's talk about the 7 signs of cancer as designated by the American Cancer Society. You can remember these by using the word caution. You can see that goes down the left side in the red letters. Change in bowel or bladder habits. A sore that does not heal. Unusual bleeding or discharge. Thickening or a lump in the breast, testicles, or elsewhere. Indigestion or difficulty swallowing. Obvious change in the size, color, shape, or thickness of a wart, mole, or mouth sore. And a nagging cough or hoarseness. Now, we all have experienced one of these things, or maybe not all of us, but we may have experienced one of these things for a short period of time. I know that every winter I end up with a nagging cough. This does not necessarily mean that I need to run to the doctor and get checked out because I have cancer. No, this just means I have a cold. Now, what they're talking about is this nagging cough or this hoarseness or some of these other things happening over a long extended period of time. Not just a couple days or a week, but several weeks or even a month. That's when we need to start being a little bit more concerned. Also, signs of cancer. The following symptoms may also signal the presence of some form of cancer. Persistent headaches. Now again, remember, this is not just like, oh, I've had a headache for a couple days. This is over an extended period of time. Unexplained loss of weight or appetite, chronic pain in the bones, or other areas of the body. Now, you may experience some pain in your bones, but you are growing. So that is most often um, the explanation for that. Persistent fatigue, nausea, or vomiting, persistent low-grade fever, either constant or intermittent, and repeated instances of infection. People who use tanning beds more than once a month are 55% more likely to develop malignant melanoma, which would be like a skin cancer, the most deadly form of skin cancer, according to the National Cancer Institute. Instead of going to a tanning salon, try tanning sprays. Or better yet, try laying out in your backyard now that it's getting nice out. Going to the beach. Maybe it's not nice enough for that yet, but hopefully soon. Conduct a monthly skin self-exam looking for any abnormalities like bumps or sores that don't heal, or moles that have changed colors, size, or shape. Be sure to check all areas. Have a friend or family member check your back. You have a couple different things here in the blue kind of boxes or whatever they're called. Fair skinned people are more susceptible to skin cancers. Blonde hair or red hair people, blue, green, or gray eye people are more susceptible as well. You are going to have a worksheet today that will ask you a question about obesity, or it's not a worksheet, but a question that you can answer about obesity and prevention of cancer. There is also this video that I will link as well. Dear 16-year-old me, have a great day. Contact me if you have any questions. Talk to you later.